you paint a scenario of what will happen, what might happen, what could happen with the federal law being either through inaction or opposition on the state level, as we're seeing in Wisconsin?
Yeah, a couple of housekeeping matters. Next, when is it? It's this Wednesday, actually. I'll be back in La Crosse, 4:30 at La Crosse Library for a listening session. So it's always nice to see some friendly faces out there, especially if we get a Tea Party cabal that shows up. So it's this Wednesday, 4:30 at the library downtown here. And then the Wednesday after Labor Day, we're going to have a Just the Facts forum on the Affordable Care Act and the exchanges, the state-based exchanges coming up. And that'll be held in La Crosse too, so we'll try to get information out for that. We got our corn roast Tuesday after Labor Day, that Tuesday, so that's coming up again as well. So I'm going to be spreading out here at the end of the month and beginning of next month, having all kinds of forums throughout the congressional district, trying to get the facts out. And we're up against a juggernaut. They're outspending us 5-1 in the media as far as negative attack ads, misinformation campaign on the Affordable Care Act. And so just over the airways, we're getting beat 5-1, which is hard to penetrate, hard to get the message out. And then we're up against the governor and the state legislature that's hostile, and they're doing everything they can to undermine the effectiveness of the Affordable Care Act. But those states that have moved forward, I don't know if you've seen the stories that have come out: California, Oregon, Washington, New Hampshire, Maryland, Jersey, New York, Minnesota. The early announcements of the premium rates are below what they're paying right now, which is very good news. And this is exactly what the exchanges were meant to foster. It was increased competition, giving people a chance to go into these exchanges and choose amongst competing healthcare plans that are finally competing for their business, giving those individuals and small businesses the same type of leverage that large companies have. But also, some of those Republican governors that are announcing rates are skewing the numbers, so you can't believe like what Kasich did in Ohio, because he was skewing the numbers there. And then they weren't also reporting what type of premium tax credit individuals would qualify for to make it more affordable. But all these blanks have to be filled in yet in Wisconsin. HHS did not know they were going to have to set up 30 state exchanges themselves. They didn't anticipate, nor did I, all the Republican governors just not having anything to deal with it. And the reason I didn't anticipate it is because the exchanges were based on legislation that I had offered for years called the SHOP Act. And every year I introduced that bill, I had an equal number of Republicans and Democrats that supported it, because it was competition in the health insurance market where competition was desperately needed. And we had tax credits too that were part of the Affordable Care Act. And Republicans embraced it, but once it became part of the overall health care reform bill, they all head for the hills. And they refused to support it at that point. But this will be a test for the Obama presidency, and I think for us as a party, is how well the health care reform bill works, how well the exchanges. I am not anticipating a perfect, smooth, seamless transition. If you all recall the Part D prescription drug bill and how that unfolded, it was a state of chaos. We had seniors showing up at forums that I held in tears because they were so confused, they didn't know what to do. But what we found in there, again, for someone like myself who voted against it, not least of which is because that prescription drug bill was not paid for at all, unlike the Affordable Care Act. We nevertheless held forums to help seniors go through the Part D prescription drug assignment. We're not anticipating any Republican doing it this time. They are just washing their hands completely of it and just throwing their own constituents to wherever to find answers. So I would anticipate some stumbles, some fits and starts to it and that, but I also anticipate once individuals start making choices, things are going to start settling down again. One of the most powerful forces in nature is inertia, just getting people to do something. And that's what the exchange is going to require them to do, is go in and make a choice amongst competing healthcare plans. But the best place to start is healthcare.gov, very good website. They have links. They'll have a link to the Wisconsin-based exchanges to healthcare.gov. So if you encounter anyone asking for information or looking for a place to go for information, that's my advice. Go to healthcare.gov. I've got my website up too, trying to direct people, and all my staff test, have been trained through the ACA, and we're anticipating hotlines starting October 1 as far as the sign-up period and that. And this is just something that people need to go through once so that they get used to it and comfortable, and then making a decision. And then I would anticipate things starting to settle down from there.
La Crosse County